The Child Mind Institute seeks a world where every child has access to high-quality mental health care. A world where clinical decision-making is based on scientifically validated tools and interventions rather than subjective observations. A world where cultural identities are guiding lights in mental health care rather than obstacles. A world where emerging technologies can be used to innovate and scale mental health care rather than create new perils, and where open principles and collaboration are embraced over proprietary interests and silos. The crises, events, and trends of recent years have highlighted both just how far we are from the world that we seek and the urgency with which we need to achieve it for the sake of the world's children. Accordingly, the Child Mind Institute has partnered with the Stavros Niarchos Foundation to establish the SNF Global Center for Child and Adolescent Mental Health. The Global Center has 6 initiatives that aim to systematically increase access, quality, and equity in child mental health care worldwide. Our experts here today are already in this space, operating in this space and making significant strides. And they share our excitement about the opportunities that the Global Center presents. The first key goal of the Global Center is to map the landscape of child mental health around the world. Toward this goal, Savri Brar will be describing UNICEF efforts to provide reliable data worldwide on child mental health and discuss the systematic survey approaches being used to overcome disparities in access to reliable data between different countries.
Thanks, Mike. Mental health conditions contribute significantly to the global burden of disease among adolescents and young people, with anxiety and depression accounting for 40 to 50% of all mental health conditions, and self-harm being the 5th leading cause of death among this population group. A significant challenge, however, is the lack of data and validated data collection tools to measure the population-level burden of mental health conditions among adolescents and young people in low and middle-income countries. In order to fill this gap, UNICEF, with technical support from the George Washington University and Karolinska Institute, as well as interdisciplinary expertise from several countries such as Brazil, Belize, India, Nepal, and South Africa, just to name a few, developed the MMAP initiative, or the Measuring Mental Health Among Adolescents and Young People at the Population Level. The goal of MMAP is to address the lack of reliable data and tools related to adolescent mental health. We do this by focusing on 4 key domains: symptoms of anxiety and depression, functional limitations, care seeking and connectedness, and suicidal thoughts and behaviors. These 4 domains are selected very carefully through expert consultation, as well as based on the global burden of disease, which I mentioned previously. The MMAP initiative aims to bridge the mental health data gap through 4 mechanisms as well. The first is developing a culturally adaptable and clinically validated tool that will be integrated into our multiple indicator cluster survey, or the MICS. The second is producing guidelines for cultural adaptation and data interpretation. The third is to establish a global set of indicators on adolescent mental health. And the fourth is disseminating knowledge products for capacity strengthening, data-driven advocacy, to inform effective policies and programs, and to make data publicly available for academic use, research, and implementation. There are 2 crucial steps in the MMAP implementation process. The first is the cultural adaptation process, which entails contextualizing the language and the content of the English version of the tool to that of the local setting. We want to make sure that in terms of the language and the content, it's better understood, relevant, and the most accessible for the adolescents in that setting. Local mental health experts and youth advisors are engaged in reviewing the tool and in providing any suggestions for improvement without compromising on the comparability of it. The second process is the identification of a referral pathway or referral protocol. Right after the cultural adaptation process and before data collection can take place, we want to make sure that country teams are putting into place a referral pathway so that information is provided to caregivers and to youth so that they are able to access mental health care and support, and especially emergency services if need be, in a timely manner and free of cost to them. MMAP is a crucial step towards improving our understanding of the mental health needs of adolescents and young people, and to develop evidence-based policies and programs to support their well-being. As UNICEF, we look forward to working with partners and the SNF Global Center to invest on data and evidence generation across populations on a global scale to better understand the mental health of adolescents and young people. At UNICEF, we believe in the power of data, and partnerships are truly the way to achieve results. Having reliable data is critical to developing effective policies and programs to address the mental health of our youth and make sure that no child is being left behind. Thank you.
The second key goal of the Global Center is to develop, validate, and disseminate multicultural adaptations of scalable psychosocial interventions. Toward this goal, Chiara Cervilli will talk about WHO efforts to develop and test psychosocial interventions for child and mental health disorders.
Thank you very much, and I'd like to thank the organizers for the opportunity for me to be here. I want to highlight as a first message that intervening for prevention of mental health condition in children and adolescents and for providing care for children and adolescents with mental health condition is a very smart investment. We have heard about the estimate based on data in 36 countries that points to the fact that $1 invested in interventions for prevention and for treatment of mental health condition in adolescents can give a return of $24 over a period of 80 years in terms of health and economic benefits. The WHO World Mental Health Report released last year provides and put forward 3 key areas of intervention and action for transforming mental health for all across the life course. The first key action or key areas of intervention is about deepening the value and commitment for mental health. And this is specifically relevant also for young people's mental health. It is important to increase financial investment, strengthen youth leadership, and prioritizing the development of community-based networks. The second area of action is about transforming environments for children and young persons' mental health and building the human capital of young people. This is related to environments in terms of homes, schools, communities, the digital space. The WHO and UNICEF Helping Adolescents Thrive initiative provides approaches and case examples for making this happen, for improving the environments within those settings with a specific focus on schools and also providing tools for integrating social emotional learning within the schools for young people. The school is a very important setting for promoting mental health and prevention, and there are data that shows benefits of capacity building within schools, as well as improving school policies for prevention of mental health condition and for reducing the risk of self-harm. But the health sector is also having a very important role to play, particularly for delivery of intervention for parents and caregivers, and particularly those parents and caregivers that face, of children and adolescents that face adversities or vulnerabilities. As an example, the WHO has developed a program for improving skills of caregivers of children with developmental delays and developmental disabilities, which has been translated, adapted, and implemented in more than 40 countries, with benefits in terms of caregivers' own well-being and caregiver skills in interaction with the child. The third area of action put forward by the World Mental Health Report is about strengthening community-based care. So we want really to make available to children, adolescents, and their families a range of options for provision of individualized prevention and care across childhood and adolescence. And this required building a competent workforce across the primary, the secondary, and tertiary care. But I want here to highlight the important element of a competent workforce at the entry access points. And these include primary health care, it includes staff within youth centers in communities, one-stop centers, it includes the school-based nurses and counselors. They have a critical role because the data shows us that they are a key entry point for improving early and timely access to prevention and care, and also the experience of young people and families in these early interactions shapes their experiences and level of satisfaction with care. We know that primary healthcare providers can be, and other entry access type of staff can be trained on assessment and management of mental health condition. The WHO has developed guidelines, which is called the MHGAP guidelines or intervention guide, providing specific approaches to assessment and management, also specifically for children's mental health conditions, including developmental, behavioral, and emotional mental health conditions in children and adolescents. And this program has been implemented in more than 100 countries. A weak element of this approach of strengthening community-based care for child and adolescent mental health is provided by the limited access to psychosocial interventions. We know that there is a scarcity of trained personnel, with global estimates pointing to only 3 mental health workers of any kind being available for children and adolescents over a 100,000 population. So the current, the recent developments in terms of the potential of low-intensity psychological interventions to be delivered by non-specialist providers for treatment and prevention of mental health condition in children and adolescents is a key opportunity. This increased evidence is also, relevant to the newly developed WHO's intervention for improving, for reducing symptoms of emotional distress in young adolescents. This is can be a key enabler. The availability of low-intensity psychological intervention can be a key enabler of transforming really, the care systems to enable the access to evidence-based care for children and adolescents with mental health conditions. The Global Center, the SNF Global Center's commitment to strengthening the workforce and to evaluating and developing approaches for interventions for mental health condition in children and adolescents provides promising opportunities to strengthen efforts and to accelerate actions to make transformed environments and improve care systems for children and adolescents' mental health a reality in countries. Thanks.
Another goal of the Global Center is to train future mental health leaders from low and middle income countries. The program will focus on early career researchers, psychiatrists seeking training in child and adolescent mental health, and media communicators from low and middle income countries. Renee Nasson will describe the strengthening child and adolescent mental health approach in South Africa, stressing the importance of mental health training for healthcare professionals at all levels.
Thank you for the opportunity to participate. Children in South Africa face many challenges and adversities, such as poverty, domestic and neighborhood violence, child maltreatment and trauma. These place them at increased risk of mental disorders. Many more, however, are resilient and deserve support to mitigate risk and opportunities to reach their full potential. Our policy frameworks, such as the Children's Act of South Africa, enshrines their right to care, protection, and access to healthcare. In the city of Cape Town in the Western Cape Province, we have embarked on a journey to strengthen mental health services to infants, children, and adolescents. Our public healthcare service is burdened by an increased prevalence of mental disorders among adults and children post-COVID. This has placed an added strain on a healthcare system beset by numerous challenges such as infrastructure problems and imbalanced resourcing and focus on acute care and a workforce insufficient to provide the need. The strength of our healthcare system is that we have good statutes and policies, governance and service design frameworks which have guided our transformation journey. One aspect of our infant, child, and adolescent mental health strengthening project is to focus on primary care services via the establishment of a team in 2022 whose task has been to gain a deeper understanding of primary care clinical services and service gaps that require remediation. The approach has been to focus on several key areas. Firstly, support of the workforce via teaching and training in collaboration with the International Academy of Child and Adolescent Psychiatry. The value of focused training for primary care clinicians is immense, and providing this via an online platform will amplify our efforts to offer opportunities to expand nationally and to our partners in the rest of Africa. Secondly, we have focused on understanding workforce capacity to conduct CAM clinical work. With that in mind, we are building competency frameworks with the intention of defining our service packages at all levels of care. Another aspect has been to improve access to information and risk management strategies via use of technology. We have therefore set ourselves the task of digitizing our systems via the creation of a website to disseminate relevant information, as well as a digital dashboard to track and monitor high-risk patient. Beyond this, we have responded to the need to provide responsive outreach and support by our tertiary services, particularly for children hospitalized in emergency care settings. An additional focus is to design a set of appropriately focused brief psychological interventions for primary care. And finally, an early years project focused on infants and mothers as a prevention and early intervention strategy. I look forward to potential areas of collaboration and partnership, which may include the following. Partnership and sharing of expertise to design and build an appropriate, locally applicable online ICAMS training platform. Secondly, a collaboration to fast-track the creation of and content for a website. Thirdly, there is a potential for research collaborations, for example, a project to gain an accurate picture of the cost of investment to improve ICAMS services, as well as a prevalence study. Next, the co-design of innovative brief psychological interventions, and lastly, access to fellowships for young researchers and early career child psychiatrists. I thank you.
Additionally, Luis Augusto Rode will describe the shortage of child psychiatrists worldwide and the importance of expanding training opportunities for those in low and middle-income countries.
Good morning. Last year, the American Academy of Child and Adolescent Psychiatry launched a document alerting for the shortage of child and adolescent psychiatrists in the US. At that time, 10,500. This is probably few child and adolescent psychiatrists, considering a population of 73 million children and adolescents in US. But let's change the geographic scenario for a little bit. Can you imagine a country with 73 million inhabitants, half of them being children and adolescents, with just one child psychiatrist. That country exists. Its name is Mozambique. You might think this might be a specific case. That's not true. In a recent investigation in the Middle West, from the Middle East, from 15 countries assessed, 12 had less than 10 child-adolescent psychiatrists. Although, and more than this, a recent estimate showed that globally we do not have more than 20 to 30,000 child-adolescent psychiatrists for giving care for the whole population of children and adolescents. Although the numbers speak by themselves, there is even more. A child psychiatrist from Brazil led a paper in The Lancet some years ago describing the famous 90 to 10 paradox that Harold already mentioned in a session before. While 90% of the children live in low-middle income countries, just 10% of the clinical trials in any area of child-adolescent mental health are conducted in low-middle income countries. What is the message here is that whatever is produced in terms of evidence-based care for the great majority of the children globally is not culturally tuned to them. Obviously, one of the key messages, as Chiara already mentioned, is that we cannot rely only in specialists to give evidence-based care for children and adolescents worldwide. But what is said in this story is that there is nothing new here. In 2005, the World Health Association, the World Psychiatric Association, and the International Association of Child and Adolescent Psychiatry and Allied Disciplines launched a document, the Atlas Project on Child and Adolescent Mental Health. The data was almost the same, the one that I'm presenting today. So, in 18 years, nothing significant happened. In this context, there is lots of reasons to have a great expectation for the SNF Global Center, and there is no better time for a center like this. Even more if you consider that one of the interventions or one of the areas of this wonderful package of initiatives is related to fellowship programs for training child and adolescent mental health professionals. And in this area, the International Association of Child and Adolescent Psychiatry and Allied Disciplines, IACAPAP, can really add. In the last 20 years, we developed several fellowship programs. One of them, the Donald Cohen Fellowship Program, dedicated for foster the professional development of local leaders in child and adolescent mental health, had 401 fellows included in the program from 68 different countries. The Helmut Hamschmidt Research Seminar is a fellowship program dedicated to increase the research abilities of child and adolescent mental health. We had 171 fellows from 51 countries. So we are in a position to collaborate to foster an even more ambitious fellowship program, a fellowship program dedicated to foster global leadership in child and adolescent mental health. I want to close this short talk quoting a Chilean poet, Gabriela Mistral, in her words registered in the Atlas Project. She said, "Many things can wait, the child cannot. Now is the time. His blood is being formed, his bones are being made, his mind is being developed. To him, we cannot say tomorrow. His name is today. Now is the time for action. Thank you very much.
Finally, the Global Center will build, test, and deploy new technologies to augment mental health care and mental health research. These efforts will leverage the Child Mind Institute's open source mobile app building platform, along with wearable sensors, to create novel mental health assessment and intervention toolkits. These toolkits will not only move clinical care beyond walls of medical offices, but to help to forge a new model for mental health assessment and intervention. To support the activities of Global Center, we will bring together experts from around the globe and across disciplines to synthesize knowledge for child and adolescent mental health care and to create active collaboration networks. Of course, all of this work is in service to the public. We will craft mental health awareness campaigns and educational materials explicitly designed for children, teens, families, teachers, community leaders, and other members of the public. These efforts will be informed by and adapted to cultural norms. I'd like to thank the panel for their brief comments today. I think they made clear both the challenges at hand for the Global Center and the optimism about what we can accomplish over the next 5 years. I would also like to thank Andreas Strakopoulos and the Stavros Niarchos Foundation team for their ongoing support and their guidance as we move forward. We look forward to collaborating with all of you. Thank you.